These are very tough times. COVID-19 has killed over 250,000 people worldwide in less than 6 months. It's extraordinary to think that just a year ago I was in Kenya, East Africa, where so many vulnerable families and young kids struggle in poverty day to day. I can't imagine what it must be like for those kids now. Nairobi is a bustling city growing with industry and business. But over 250,000 people live here in Kibera, an overcrowded community around the size of Central Park.
I see a lot of children running around, a lot of people going about their days. I imagine sickness, disease, things like that spread really quickly because standing water and sewage and little babies running around. The diseases that are coming around here, these are diseases that kill kids. They shouldn't have to live with, I guess, the constant threat of disease popping up and yeah.
Living conditions are cramped, social distancing virtually impossible. For infectious diseases like the coronavirus, places like this could quickly turn into a nightmare. Your donations are already supporting an army of community health workers like these across the globe in places like Tanzania, Afghanistan, and Bangladesh, whose daily fight is to keep kids alive and healthy. Here in the heart of this community is an amazing clinic where nurses like Grace are on an absolute mission to keep kids alive.
It makes me proud to know that I'm protecting children from being sick.
Her job was really hard before coronavirus. Imagine it now.
You've seen how sick kids can get if they get an illness like what they're exposed to out here. So help them out. You can help them out. So the rain's just started. To be in a home with no lights, no electricity, with raw sewage outside your front doors rising up, probably gonna come into your home, and you've got your kids there, you're trying to keep them healthy. I mean, it's...
Before the COVID pandemic, it was already unbearable. And that was just one community, in one city, in one country. And now, with lockdowns in place and parents losing whatever work they had, the coronavirus is absolutely set to tip people living on the knife edge of survival into a full-blown health and hunger emergency. And we're not just talking hunger, we're talking about the very real threat of real acute malnutrition and starvation, with the little ones, the kids, most at risk of dying in their thousands. But the crazy thing is, you can actually help do something about this right now, tonight. You can help fight the disease. You can help defeat the hunger. Just $35 can buy 50 masks to protect nurses like Grace while they do their life-saving job. Please call 1-800-500-4373 or go to rednoseday.org and give that $35 or more, or anything that you can afford. Thank you so much.